Today we have Dr. Shauna Pollard, who is a licensed clinical psychologist and ADHD expert who brings a unique blend of personal and professional insight into her work. Diagnosed with ADHD after completing her PhD, Dr. Shauna has firsthand experience navigating the complexities of living with ADHD as both a clinician and an entrepreneur. She is the owner of a solo practice where she focuses on supporting ADHD clients, particularly in communities of color, and she leads a dedicated group for BIPOC therapists with ADHD. Through her clinical work, Dr. Shauna empowers others to not only manage their ADHD, but to embrace their neurodivergence as part of their identity. I'm excited to dive into her story and expertise today. Dr. Shauna, how you doing?
I'm doing great. I'm so glad to be here, Janice.
Yes, yes, yes. So today we're going to be talking about ADHD and money, which I think is going to be such a great topic. When it comes to money and ADHD, it can be really challenging. Money can be stressful, especially when we think about our BIPOC communities. I myself, as a woman of color, while I am neurotypical and don't have ADHD, still stress about money because I didn't come from money. When one is stressing about money and then stress impacts those ADHD symptoms, it can amplify some of those symptoms like the disorganization, the impulsivity, the inattentiveness. And so then you might forget to pay your bills on time. You might struggle with organizing your schedule during the day to be able to make time to go buy the groceries. And if you're in this perpetual cycle of having a hard time meeting your basic needs, or you're struggling to keep up with the timeliness of showing up to a job and potentially getting laid off. We do live in the US where there's a welfare system to help us if there's like trouble with work, but then even navigating the whole welfare system takes a lot of organization and timeliness. Dr. Shauna, I'm curious, what are some of your experiences when it comes to ADHD and money and the costs of that?
Yeah, ADHD that's unmanaged, and even when it is managed, can be expensive. Everything from getting a diagnosis
Mm.
to keeping up with doctor's appointments. A lot of my clients are out of network. I've been out of network at times. And so you have to use a lot of organizational skills to keep up with documentation, to submit documents, submitting documents late. I've submitted a license late, license renewal late because I got confused and I thought it was being processed and it wasn't. And I didn't ask or ask for help. And when I went to back to check on it, it was late. So I had to pay the late fee. And then I had to stress about, oh my gosh, my license is lapsed for a day or two. Thankfully, wasn't working during those days. There is a tax in the literature and even on social media. There's a lot of talk about the ADHD tax, the cost that you pay when your ADHD is unmanaged. Everything from parking tickets to library fines to missing a flight to booking a flight late at the last minute, which can cost you hundreds more than if you booked it months in advance. To I ended up taking an extra year in graduate school. I don't think about that cost, but there's a cost associated with that. I had a fellowship, and so it wasn't as expensive as it could have been. But there's a lot of cost to being disorganized, making last minute choices, not tracking your money and where it goes, and not finding out there's a problem until it's been too late. I could go on, but that's just some of the things that I see for folks when it comes to money and a little bit about what I've experienced.
Yeah, for sure. And I think about how, as women of color, when we look at the national statistics, we know that we get paid less than a white man. Also, as you were bringing up the costs of your career, when we're the first in our families to pursue higher education, there's a lot of unknowns that come with the process of being able to complete the degree. Thankfully, we can try to reach out to like mentors and advisors, but they don't talk to us about money. They just assume you're going to pull out some loans or you can rely on some generational wealth. But then when it comes to the BIPOC community, sometimes we don't come from that generational wealth. And so we grow up with seeing the stress at home with whoever we're living with. And then we feel that stress and that anxiety. And we carry that into adulthood. And I wonder, have you seen that show up for any BIPOC ADHDers that you've encountered?
Absolutely. I really relate to what you said about the stress of money always being present. Is there enough? Is it okay for me to ask for this thing if I know like we don't have enough money? Or is it safe to want the things that I want or ask people for them, right? When there's money problems. So I think at an early age, I grew up thinking about money and knowing that I wanted to me, money represented safety, right? If you had money, the idea would be that you would have less stress, that you would have less things to think about because not having money is very stressful and it
Mm.
can cost a lot of money, right? And so you're right, like grad school is just expected that you have the money for whatever's involved. And I've found the degree to be very expensive because it's even especially when you think about the internship years, right? Having to
Oh,
go all these
yeah.
places and interview and stay in hotels or on people's couches and things. So it can get really expensive to get out of the degree, so to speak. It's like I've come this far, I've invested all these things, and now I've got to pay even more just to get to the next phase to be able to finish and go to a place where I can make more money. So I feel like for me, that was the constant pressure of I can't stop. I have to
Yeah.
keep going because one, I've already spent so much money to get this degree. So I think even when there were times where I was exhausted or stressed out, I don't want to do this anymore. You have to. You can't afford to stop because you've already taken
Yes.
out these loans. And so
Yep.
you better figure it out and finish it up. And
Yes.
so, yeah, it sounds like you can
Yes.
relate
Oh
to
my
that.
gosh. Wholeheartedly. I remember how I pulled out so many loans. So you've invested so much in this career. You've sacrificed so much of your time, your relationships, especially when you come from a family where you're the first gen college student. They may not understand why are you working so much or when are you going to graduate? And then I had to delay my timeline, right? I had to extend it because it just wasn't working out for like different reasons. So I was like, it's cool, but I cannot stop. It may take me longer, but stopping was out of the question because if I stop, where am I going to live? What am I going to do? And so I needed to stay as a student to have access to the loans so that I could sustain myself financially while finishing this degree. And when you brought up that internship year, oh my God, like I got into so much credit card debt because while we did have access to loans, that wasn't enough. And then I had to rely on the credit cards for my basic needs when I was doing my postdoc fellowship because I also didn't get paid a lot because we were not licensed. So it's definitely very costly. And what a privilege it is too, right? While I recognize the sacrifices and the difficulties that came with it, I also recognize the privilege that you and I have made it to the other side.
That's something that all ADHDers don't. I didn't get diagnosed until after I had completed my dissertation. I was on my internship
Mm,
year where I was prescribed medication for the ADHD, but by then I had completed a whole dissertation. And so a lot of ADHDers aren't so lucky. A lot of folks don't make it past the dissertation stage or don't even make it to graduate school because the process of applying and getting in is so stressful and it involves so much of a sacrifice and it does involve so much executive function to be able
mm,
to study in that way. And I
yep.
tell people I knew something before I got long before I got diagnosed, I would tell people it's now or never. I pretty much have to go straight through because if I stop, I'm not coming back. And something about me just knew that I might as well do it while I'm a student, while I'm used to being semi-broke, because once I get a job and I'm doing well, I'm not going to take a break and go back to school, right?
Yeah.
So I have a lot of respect for folks who do and who are managing so many things at the same time as they're trying to get an education, right? Like maybe they're a caregiver in their families, maybe they have children, a spouse, like other responsibilities. I had the luxury of being single and being able to 100% focus on my career. And I think that's why I was able to make it through because I was able to hyper focus because I studied things that were very exciting and very interesting to me. And so I really loved what I was doing. I was passionate about the lab work that I did. And I was fascinated about the field of psychology. And there's so much to keep you interested. I think it's a perfect career for ADHD because even specializing in ADHD, I do way more than specialize in ADHD. So I think because I had hit the sweet spot where I found something that was very interesting, where I could do a lot of different things, and I had a lab that was super supportive, and I had fellowship funding, and I had an internship that paid okay. Paid
Mm.
probably fairly well compared to most internships because I was with the VA system.
Oh, yeah. I
And so
had considered
yeah.
that for a second because of the pay.
Yeah, so I had a lot of privilege going through the system, even as I experienced some of the stressors that can come with being from a community of color as you try to be the person in your family that succeeds and does well, without necessarily having a roadmap for what that looks like.
For sure. You brought up how you recognize within yourself getting into the field of psychology fits well, especially for ADHD, because it allows you to learn so much. But then recognizing that you got late diagnosed, right? And so, what we know about ADHD, especially with women and little girls, is that they're often socialized to have to compartmentalize, to overcompensate, which leads to these underdiagnoses for ADHD. And as we think about the trajectory of knowing that it's hard to get a PhD, and college and pursuing higher education can be challenging for ADHD. Research has shown that when it comes to ADHD, they're more vulnerable to not being able to graduate from college. And even before college, there's also the ADHD that shows up, especially for students of color, when we think about middle school, high school, especially when it comes to Black and Brown boys, that when they go underdiagnosed or overlooked in having ADHD, they are very much stereotyped into, oh, he's just like that. That's just how he is. And then they end up getting sent to the principal's office or getting
Behavioral
suspended.
problems.
Exactly.
Yeah.
They just see it as behavioral problems when it could be ADHD. And then what happens is it leads a lot of these Black and Brown boys into this school to prison pipeline where they're not even given a chance because they didn't get the support that they needed in the schools early enough, that
Mhm.
they get discouraged, or there's impulsivity, which can lead to some delinquency, but then they don't get that support. So then they end up in jail. And then how are they supposed to get themselves out of that cycle and into financial stability?
Yeah, and if we're talking about money, right, being incarcerated is super expensive. Even when you think about the loss of income to a family system
Mm,
from this person not being able to work, the loss of the ability to generate money-making skills, and then once you get out, country's supposed to wipe your slate clean, but we know that's not what happens. Like it's very hard to get a job. And then folks will default sometimes back to the things that they knew how to do to make money, and so it is a trap, and you're right. A lot of folks, I think someone did a study once about how rampant ADHD is in the prison system, right? Because it
yes.
makes total sense from a diagnosis perspective. If you're impulsive, if you don't think through the choices or the decisions you make, or you don't have the right some support to steer your ADHD symptoms into for the greater good as
Hmm.
opposed to other directions. And like you said, even sometimes folks will not get, they might get appropriately diagnosed, but they might get undertreated, right? They might be over medicated for the ADHD. I've seen that
Oh,
sometimes where
yeah.
folks don't want to take meds because they had such a terrible experience in the past with feeling like a zombie and having doses that were too high. And I even see in my clients who do have good access to healthcare providers that a lot of providers just do not understand ADHD. And so they will say that it's not a thing or it's not something that adults have.
Yeah.
They will refuse to treat it, or even if you have a formal diagnosis, even with the medication shortage, it's just really hard to get access to quality care. And even amongst clients who are super well resourced and not BIPOC, they still have the challenge where they get diagnosed and no one explains what ADHD is. It's just like, here, you have a disorder, here's some medication, good luck, goodbye.
Yes.
I'll see you when you come back for more meds.
Yes, exactly. I have heard that too. I've definitely come across ADHDers who are sometimes given the diagnosis as a kid, but
Right.
nothing is done about it, especially when I think about the stigma with mental health within the BIPOC communities. There might be some shame or just not having
Absolutely.
access to the education about what resources the kid needs. Then you brought up even with adults, where yes, I too have heard from people who have an ADHD diagnosis where they get told, like, you're an adult. This is something that happens to kids, or you grow out of it. It may look different, but it doesn't just
Right.
disappear. But
Right.
again, it's this lack of education, and ADHD can impact so many different areas of one's life, whether it's relationships, eating habits, keeping a job. And then the other piece is relationship with money. So that leads me to this next question about how ADHD impacts the comfort with money. So when I think about ADHD and money, and especially when I think about BIPOC folks who don't come from money, they want to break that cycle. And because there's difficulty with organizing and time management, then it can lead to feeling avoidant because you're overwhelmed with how many bills you got to pay. Who do you have to call to switch the internet because maybe this place charges less than the other place? And then
Yeah.
you, so
Yeah.
it's just so many things that can lead to feeling avoidant, overwhelmed, which then perpetuates the cycle of continuing to have difficulties with money. And I wonder, what are your experiences, or what have you seen when it comes to ADHD and that impact on comfort with money?
Ooh, so that's a big question. It's so all over the place where some folks come from backgrounds where money is scarce, right? You never have it. And so the way that can show up in adulthood is holding on to it tightly. Whenever you do have money, you never want to spend it because there's a fear of being broke again. Or for some people, that can feel like really being attached to your career and working too hard and burnout because it's like, I have to do the opposite of what I grew up in. I'm never going back to that experience. I want to make money, and that's what I'm here to do. So it can show up in that way. One way I've seen it show up interestingly, I know for me, it was a sense of I know how to save money, I know how to be frugal. I got that down. I feel like that allowed me to get through grad school because if you're good at being frugal, the roommates and not eating at certain places and the discounted meals, right? Got that down. But really, when you enter into running a business, you have to spend money sometimes to make more money.
Oh,
And so
yes.
I find that like other people have to support me in working on my money mindset and encouraging me to think big and to think expansively and to figure out when is it good to spend money so that you can make more money. And I think sometimes after going to grad school and all the student loans, a lot of folks are like, I'm tired of spending money. I have all these loans to pay because I spent too much money.
Mm.
But like when you think about running a business, you do have to invest in yourself at certain levels. And there may be hesitance to do that because of beliefs around what it means to have money, what it means to make money. So it's all these tangled up beliefs around what does money mean to you? When is it okay to spend? When is it okay not to spend? And then you have the other side of folks who are overspending, right? Because sometimes money and spending can be attached to like how you're being perceived by other people. And so I want other people to perceive me as a person that's not broke. I want other people to perceive me as someone who has means. And so then there's this spending to make an impression on people for impression management, which is okay, perhaps if you have the money, and maybe it's okay if it's just a little bit. But like when you start to constantly live out of your means, which is we can get into a whole nother, we can go down a whole nother rabbit hole. And when you talk about social media, right? And the pressure to embody or live a certain lifestyle, go on international trips and look a certain way, right? So then a lot of people are spending money that they don't have
Mm.
to portray a lifestyle that they would like to. And that ends up leading to some other challenges. And then, like we said before, If you've made mistakes with your money, which I think almost every ADHDer has, anything from forgetting to pay the bills because it's auto pay, or losing tickets and not realizing you have to pay until you get a late fee. If you have made a lot of mistakes with money and you have managed money poorly, then there could be a lot of shame around that, a lot of guilt around that, a lack of confidence around your ability to manage money. And usually the way that people handle those things is to avoid. I'm not going to look at it. I'm not going to think about it. I'm just going to push that mess away. What happens the more that we push our problems away, they just build and stack. A good example that comes up is like not paying taxes, right?
Oh, yeah.
So if that's gone on for multiple years, right? If you didn't want to pay 1 year's worth of taxes, you really don't want to pay 4 years worth of taxes. And yeah,
And you
and
also don't
it
want to
gets,
pay the accountant to do that for you. That's my,
oh, absolutely, absolutely. And I think that's when, like, when you enter entrepreneurship and business, is knowing when it's important to spend on something like an accountant, because it is painful, but it will save you money down the line if you invest in the right person. So yeah, it like ADHD and money, I'm sure if you have some accountants on, they would really tell you. One thing I see a lot in a lot of the therapist groups is when you start a business in private practice, an easy mistake that a lot of people make is forgetting to set aside money for quarterly taxes.
oh,
Um,
yeah.
and that can be such a hard mistake to start off with, because then you owe like thousands of dollars. And you're like,
Yeah.
The other thing that makes private practice hard too, from a money standpoint, is it is not stable income. You're like, can I afford this vacation? I don't really know, because I'm really not sure what I'm going to make next month. In
Hmm.
some ways, you don't really have control over that unless you overbook yourself and you see so many people to make up for the ebbs and flows, because they talk about slow seasons and busy seasons in business. So
Hmm.
yeah, there's so many ways that, and like you were saying too, with not going to the grocery store, like a lot of us have fallen into bad habits around like not cooking, which
Mm.
is a super money waster, because if you eat out, you're wasting a lot of money. And then if you get into another bad habit of ordering food through Uber Eats or DoorDash, then
And that has
again,
gotten expensive with the years. They keep adding some fees that I'm like, what is this? I don't know, but I gotta
right.
eat.
You're like, I want something for $10. Okay, it's $40 now. It's
Yes.
just that it can just really stack up when it comes to poor time management, poor planning, inability to prioritize. And then also when you think about interoception, sometimes not being able to tune into your body's physical symptoms. And so you may not realize you're hungry until you're really hungry. And then when you're really hungry, you want something immediately. And
Yeah,
so,
yeah. And then the cooking it also takes executive functioning because you got to plan to have the ingredients to be able to cook. And then the
you have to
cooking is a
pick a
bunch of
meal.
steps.
You have to shop. You have to make sure the stuff is fresh when you need it, because
Oh,
I, along
yeah.
with my other clients, we might have stuff in the fridge, but we don't want to eat that anymore. Like,
Yeah.
and so then things are going bad, and constantly throwing away things, and the guilt that comes with that. So
Yeah.
it's a lot.
It definitely is a lot. And if we had more time, I'm sure we could talk about it even some more. So, as we start to wrap up, my last question for you is where can people find you and if you have any offerings?
Yes. So I'm on Instagram at Dr. Shauna P, DrShaunap. And I post some content on there. I'm on LinkedIn under my full name, Shauna Pollard. And have a website, www.drspllc.com. I run a group for BIPOC clinicians with ADHD. It's a 6-week group. And we work on the admin side of being a therapist. It's not a therapy group. It's like a business consultation group. And so we help folks create systems and just talk about the things that help us to manage time better and deal with documentation. So documentation
Mhm.
is huge for ADHD clinicians, and sometimes folks fall behind. And so having support around dealing with the backlog and learning how to run a business is really helpful. And my caveat out there is some folks are like, oof, Investing in my business feels hard. If somebody tells me to do something, I can do it, but making a choice to invest is hard. But I tell people I've lost so much money by not having good systems in place. So I encourage people to really be thinking about, if you're going to invest in your business, where that money will give you an ROI on the back end. And so many of my clients find it helpful. And I tell people, being in community around being a BIPOC clinician and around being an ADHDer, those things have been fundamental for me. So yeah, everyone listening to the podcast, I would encourage you to find communities of other folks. So keep listening to this podcast, listen to all the episodes. I would say if you're a BIPOC entrepreneur, find other entrepreneurs, find other BIPOC folks doing the same thing, connect with them. And the community is what helps you when you go through the rough patches. So I'll stop
Yes.
there.
Thank you so much. I'll make sure to have your contact information on the show notes. And I'm so excited for your group. And I hope that whoever is listening and is a BIPOC clinician with ADHD will consider it, because I agree with you. The return of investment in being able to have a space with other like-minded folks who are having similar struggles can make such a difference. And when it comes to starting a small business, especially when we're first generation professionals within our field, like nobody else in our family has done this, then you're going to make mistakes. That's part of the process. But then those mistakes can cost you, and you don't want to keep making more and more mistakes to the point where you got to shut that business down. You want it to grow.
Yeah.
And if we're going to have it grow, we can do it with community. And so I'm sure that group will be very helpful. And I hope that plenty of people will join. And so, yeah, thank you so much. And I'll look forward to hearing more about you through your Instagram, because I do love the content you share.
Oh, you share excellent content. So
Oh, thank you. What a fruitful conversation we had with Dr. Shauna today. I really loved how she brought not only her personal, but professional experiences when it comes to ADHD and money, and learning about what the ADHD tax is, because not treating your ADHD will cost you. And while it was so beautiful to have been talking with another psychologist, y'all got to hear two psychologists in this episode. It is also not a replacement for therapy. However, we do appreciate y'all listening, and take care.